All right. Well, thank you all for coming out this afternoon. I'm going to go ahead and call the meeting to order. And at this time, I'm going to ask the secretary to please call the roll.
Senator Rocky Adams, Senator Funky Fromeyer,
Present.
Senator Harper Angel, Senator Mays Bledsoe, Representative Heverin, Representative Mosier, Representative Neighbors,
Here.
Representative Stalker, Co-Chair Meredith, Co-Chair Meade.
Here. We're going to go ahead and get started with the discussion. Today, we only have one thing on the agenda that is a continuation, unfortunately, of what we had last meeting. And so at this time, I'll call the cabinet to the table if they would. And as you come up, please state your name for the record, and you may go ahead and proceed with your testimony.
Oh, there it is. Eric Friedlander, Secretary of the Cabinet for Health and Family Services.
Good afternoon, Lisa Dennis, Commissioner for the Department for Community-Based Services.
Good afternoon, Todd Trapp, Director of the Division of Family Support.
We're getting used to these. So this is a continuation from last month. We first, just let me say that we have actually, I thank the workers who were here last month. I apologize to them on my behalf that we were not here to back them up. My assumption was, as we did with social workers, we were bringing you the reality from the field. And so, again, our apologies for not being here. We're here now. Lisa, would you like to begin?
Sure. Good afternoon, and thank you again for the opportunity to be here and to talk about public assistance benefits and our application process. I too, like the Secretary, want to personally thank, and I have reached out to our workers and told them thank you for being here and speaking up and sharing their experience as a frontline family support worker. And I wanted to take just a minute to revisit some of the information shared last month by them. They talked about, when they were here, our points of access. We have 3 primary points of access for clients to make application or receive services. So we have at least one office in all 120 counties across the state, and in every one of those offices we have family support staff present. So individuals can go into any of those offices throughout the 120 counties. It does not have to be their county of residence. So they can visit any of our local offices to receive services. They can also receive services via call services through the phone, or they can utilize our self-service portal to access services. So with those 3 points of access, our family support staff largely, our frontline staff largely work in one of 3 areas. They are either serving clients in person in the office, face-to-face, or they're serving clients on call services, or they are serving clients through by processing their case. They are processing what we call a support service task, and that work happens behind the scenes when verification is returned or there's actions on a case that needs to be completed. So those staff that are processing, when they are processing, they're not having any direct client involvement. Sorry, I just noticed my light wasn't on. They're not having any direct client involvement. So that those workers, family support workers, can work from anywhere within the state to serve a part of our population. So when we talk about support service task, what we are talking about are actions that are due on a task, on a case. So a task is any action that's due on a case for it to be processed, and every task is associated with a task due date that is based upon policy or regulation, what have you. So we have a lot of different task types. There are actually 316 different types of tasks associated with casework. So you can see the work that is completed by our family support staff is very can be very complex and very nuanced. And these tasks are assigned to a worker based on their skill level. So if a worker has been with us, and a tenured worker who has been trained in all program areas, they likely can work all of those tasks. But a younger worker, a newer worker, may only be able to work in one program area and therefore can only work those tasks associated with their level of training. So if you are a new worker and you're only trained in SNAP, you're only going to be able to process tasks associated with SNAP-only cases. So again, that's kind of just to kind of walk through what that workflow looks like. And here from this slide, you can see that for the time period of July through October, we were receiving about 500 more tasks per day than what we were able to process.
So family support workers saw essentially a 40% increase in their workload across the board. And that is an accurate number, and it's a challenging number. And I want to just give you a few examples of different types of tasks, if I may. One is, Commissioner Dennis already talked about SNAP. The most difficult cases we have are what are called adult medical benefits. So those are nursing facilities, waivers. Those are the most difficult because we're doing asset testing, which means we're looking at what property somebody owns, all regular income, but then also passive income. So it is a more complex task, as well as then determining assessments and whether those assessments would meet nursing facility level of care. So that's the most complex task we have.
Yes. And there were two major contributing factors for the increase in tasks that we had been seeing. The end of the public health emergency and the beginning of the Medicaid unwind that started on April 1st. That resulted in an average daily task increase of approximately 360 tasks per day, just as we were beginning to move into that unwind period. And then the other factor, and both of these, I want to just reemphasize that both of these factors that we're talking about here were things that we hadn't experienced before. We have never been through a pandemic and had to go through Medicaid unwind before. And then during the pandemic, we also seen a turnover that we have never seen before in our staffing. DCBS, like most everyone else, experienced historic turnover, and family support was not. Was also impacted. We lost approximately during the pandemic 50% of our staffing. Now, the good news is that this past year we've been making progress in hiring, and we are to the point that we are probably better staffed in family support than what we have been in a long time, if ever. And we are approaching close to our personnel cap too. So we made a lot of progress in hiring, and that was largely a lot of that was due to the increase in compensation that we've seen around salaries. And so we appreciate the efforts with Governor Beshear as well as the General Assembly on all those raises, and recognizing our family support as part of that safety net and continuum of care. And also, in addition to raises, there were shift in locality premiums that were made available to our family support staff. And then, but with that also, with the good news of having an increase in staffing, we also know that those staff have to be trained. And that takes a lot of time and a lot of resource from our tenure staff, our supervisors, as well as other agency supports to provide that training and coaching and mentoring. We currently have approximately one third of our workforce, our frontline family support staffing, that is in some phase of training. They're what we call non-case decision workers. They cannot process a case independently, so someone is having to read behind them to determine whether or not they are processing the information and determining eligibility correctly. And that's important because our SNAP program, like all of our public assistance programs, are regulated by the federal government, and our accuracy rate, if we do not maintain that, then we risk losing federal funding. And currently, Kentucky we kind of go between first and second, but we have either the first or the second best payment error rate in the Southeast region. So our supervisors and our staff are doing a good job in training and development of our frontline staff. We just, we got 400, or approximately a third of our workforce that's currently in that training phase right now.
I like to say the good news is that we have more staff and we've hired a lot of folks. The bad news is we've hired a lot of folks and they're all new. So we're doing a lot of training and that slows us down a little bit. But I really do believe, particularly this past couple of weeks, we may have started to turn a corner where you saw the slide ago where we were receiving more tasks than we were able to process in a day this last week.
Yes.
We've now finally been able to turn that corner, and we're starting to process more tasks than we receive. But as I've told you all before, a week does not a trend make, so we're going to have to keep an eye on it. But we hope that we have turned some corner there. The challenges are still tremendous. I think this is the point where I've been worried about for a while. And this increased workload, folks who have never processed Medicaid recertification before because it's been 3 years, we're basically bringing everybody up from almost start on this.
So we've done a number of things to try and prepare for this increased workload. In addition to the increase in hiring and the support around staffing that we just spoke about, we've also worked to increase our public-private partnerships with contract staff. Again, there's a lot of requirements around federal requirements around how we utilize contract staff. So where we had the flexibilities to use more of that public-private relationship and with contract staff, we have done. As part of the unwind, we entered into a contract with Tech Systems to assist with those Medicaid tasks specifically. So then we've also we have implemented various program flexibilities as part of the Medicaid unwind also that are allowable. We also worked with our OATS team, our IT partner within the cabinet, to implement an optical character recognition program. And what that program does is for our SNAP cases, it can automatically read certain pieces of information and process that without a worker having to physically touch that particular piece of information to process it. Also, as part of one of those flexibilities that was available for SNAP as part of the unwind was around the SNAP mid-review process. So during the unwind, instead of having to complete a recertification, we can send out a mid-review packet of information to individuals, and they can complete that and return it back to us and not have to come into our office or call us on the phone to complete that recertification process. And then if there is no change as part of that return verification, then that OCR tool can process that case and to help with some of that workflow. And here you can see for September, approximately 33,000 mid-reviews were sent in place of recertifications. And then we also launched the Elderly Simplified Application Project on October the 1st, and that was part of House Bill 7. And it's to simplify the SNAP application and verification process for older and or disabled individuals. So the big piece, the big lift there was it moved that recertification for that population from 1 year to 3 years. And at the beginning of October, 97,000 regular SNAP cases were converted to ESAP cases. So that has been another lift on some of the workload for our staff. And then the distribution for some tasks changed from local to statewide. We made that change effective mid-June. And that was a change that we felt that was necessary, maybe not popular with all of our staff, but when we were looking at our processing and before statewide processing was implemented, our outstanding task for processing was not evenly being distributed to all family support staff throughout the state. So those areas that had better staffing and more tenured staff, they were seeing less past dues, and where some of the areas of our state had, again, less staff and less tenured and less experienced staff. So that decision was made to even out some of that workload and to provide a more equitable approach to providing needed assistance to all Kentuckians. And then we also have our staff had the ability to process case actions by call services or in person. So what that means is someone comes into the office or they call in on call services and they have all their information there. It's all with them. Our staff are able to process those cases in real time. And then two, when we're talking about we're talking about some of those task changes moving from local to statewide. I want to make one other point about that. Not all tasks were moved to statewide processing. Approximately 45% of our tasks moved to statewide and 55% remain local. And again, those 55% that remain local were those more difficult cases, those long-term care, those KWP cases that needed that local support and additional assistance. And then the last point here on this slide is that we are currently developing and implementing regional processing teams. So we'll have dedicated staff that will be focusing on processing, and those are staff who are really efficient at processing. And so again, we're working with our regions to put that in place to begin next month.
So I can summarize. One, people that call in, and I've been asking folks to use the internet, use the self-service portal. That's been a challenge too, frankly. One is our call lines, once you get through the conduit front end, our wait times are a couple hours. It's true. We're allowing folks to get called back and work for that option, but all of that you hear of long wait times for eligibility workers, true. We're working on it. And hopefully once we get more workers who are up and trained, we'll be able to work on those timelines. The move to statewide was controversial. And I can understand it from a regional and county-based perspective. One of my favorite things when I was working for Louisville Metro Jefferson County is I only had to worry about Jefferson County, and that was fun. But regional and rural counties, folks get into this so that they can help people they see at church, that they see at groceries, that they see in their community. And when we move to statewide processing, it feels like they can't help their local person anymore. And I think people people did experience that as a loss, and came to us, and we've been back and forth several times. And my fear about, and I'll own it, my fear about moving away from statewide processing. The reason we went to it is, if you were in Jefferson or Fayette, who knows when your case would be processed. That's kind of how far behind we were, and hiring more people in Jefferson County, and we do pay a premium in Jefferson County because we can't necessarily compete with employers in Jefferson County. We started out with 100 case workers in Jefferson County. We're up to 140, so it's a nice increase, but it's still a challenge. And so I think people who process statewide, who don't get that locale premium feel really put upon, right? They're processing Jefferson County cases too. So there is controversy there, and I want to own it and name it, right? There was another piece in there. Oh, and even with all these challenges, right? Even with what we described, and even with what you've heard, Kentucky is just center of Medicaid unwind when you look across the states. There's a place, the Kauffman Family Foundation, lists all the states. When you look at our rates of people who get enrolled, people who lose coverage, those percentages are within 1 percentage point of the national average, just straight across. We absolutely couldn't really be more average, which is not a humble brag or anything. It just is what it is. And lastly, thank you for sharing some of the emails you all have been receiving. I want to say this to the folks who sent to you their concerns. I want to say thank you. Right? The whole point of us being able to work together is if somebody has a concern, we've encouraged people to use their voices. And we do. And we've said to folks, there's no retaliation here. And there isn't. So I don't want anybody to feel bad that they've reached out directly to you. They get to do that. Right? They get to do that in a democracy, and it was really appropriate because it looked like it was personal email. That's exactly what we'd want folks to do. So even though it's critical, it's okay. You all need to hear, and that's what we were trying to do last month. You all need to hear exactly what it's like and what that experience is in the field. And so while that's not always pretty, it is real. And that's what we're supposed to do here.
All right, before we get into questions real quick, since we have a quorum, I'm going to back up for just a moment and do the approval of the minutes. So with that, is there a motion to approve previous minutes? We have a motion and a second. All those in favor, please signify by saying aye. All opposed, nay. Motion carries and minutes are approved. Now, we will move into questions. I think Representative Mosier has a question.
Thank you, Mr. Chair, and thank you very much for your presentation. And I want to thank you for being so responsive to all the emails that I keep forwarding, and I'm probably not the only one. I think we're all copied on these emails, so maybe you're getting them in triplicate. But you have been very responsive, and I agree. When folks who are working on these problems, on these cases, on the ground level, they're the ones who are seeing the real issues. And so we've been able to, I think, fix a few of those. I know that you worked on Saturday on the pharmacy benefits, and that was a waiver issue, but nonetheless, it was in response to an email that we got. You mentioned a personnel cap. Is that Did a personnel cap get implemented because of the raises? Is that what I'm hearing?
No. We've always, either one of us can do it. We've always had a personnel cap, which is basically the funded positions in a budget since 2017, because our numbers kept going down. We never even got close to it. Some folks didn't even know what a personnel, within the cabinet, didn't know what one was. And so it's a funded level of positions, and we've never bumped up against it in my knowledge. I don't remember the last time we bumped up against CAP and DCBS, and we are now. It's a good challenge to have. But that's what it is. And we're essentially at CHFS, not to bring up another sore subject, but we're essentially a cap across the agency with the exception of the Office of the Inspector General. And even there, we've made a little progress.
Okay, all right. And if I may ask one more question. Thank you. When I was reading through, I think the last email that I sent you, and I know they're long and in great detail, there were some comments about the tech system and duplications in the processing. Is that because we don't have a robust enough communication system? Do we have anything akin to electronic health records? What's the interoperability of that kind of system? I just asked about 4 questions, sorry.
You did, and I'm going to let the experts answer. But we try to keep asking you the same question a number of times to a minimum. I'm pretty sure the experience of folks on the phone would not reflect that effort on our part. But I'm going to turn it over to Lisa and Todd on that.
You want
You can
Well,
start and
yeah.
fill in if I need to.
so?
Can.
So yes, I think with some of our contract staff that we do hear that sometimes because they are not able to serve the client and meet their needs. So then the client has told them what they needed, and because it's not something they can do within their workflow, then it has to be transferred to a worker within DCBS, and the client then again has to state their need over. So that is something that we hear from staff and from clients. And I don't know of a way to really resolve that because again, the workflow of our contract staff is created based upon the guidance where they are allowed to function, and so there will be, I think, some of that duplication. Todd, you want to add anything or?
I agree with all that. I was going to say the tech staff they work from a list of things to process. So I don't know if that was part of the duplication too, because there could be down the road a task associated with the work they've done. So that would be some duplication. But they should all, anything done on any work done on the case should show in the same electronic case record. Right. So I think that's an answer to one part of your question as well. So that should all be in the same record.
Okay, yeah, that was my question.
There are two other things as well. That tech staff, because of what they're doing, we're hoping to transition some of them over to the state. It's kind of like
We already have.
right? So that also gives them some training. The other piece that I'd be remiss not to mention, at the end of the previous administration, there was a waiver for SNAP where some conduit staff could make a case decision. Hindsight's 2020 now, but it wasn't working at the time, and DCBS was spending more time training conduit staff than actually able to get to the phone line. So again, owning what I need to own, we pulled back from that waiver. Again, hindsight, and that was pretty early, and we haven't gone back. It's very, very difficult to get a waiver for somebody who is not a state worker to actually declare somebody eligible. It's a longer discussion, but again, full disclosure, right? That is accurate.
So the tech system then, are they just doing kind of the preliminary work and then teeing it up for a DCBS worker to actually process? I'm not sure I understand the charting. I mean, just going back to my nursing days, we charted about a patient and you pick up where you left off. You don't do it again.
They're processing the only Medicaid cases, and they basically, and it escapes me now the name of it, when the renewal packets go out and then they come back in, that's what tech's processing, those return renewal packets. So they start the process. Some of those they may be able to process basically all the way through, depending on what action's required. Some of them require creation of a task, which is going to then be picked up by a DCBS worker based on their level of training.
All right, thank you.
Mm-hmm.
And one other thing I meant to say earlier, and I'm sorry to interject kind of in your questioning. Kentucky has what's called an integrated eligibility and enrollment system. It's called an IEES. 90% of the time, that works to our advantage. Other states think it's like where they're trying to get to. Under Medicaid Unwind, and let me be clear, the system is groaning. It really is. From a personnel perspective, from as we make changes in systems to try to streamline perspective, it's not broken. Like I say, we're right like smack dab in the middle of other states, but it is groaning. There is no question about that. And so it may not be to our advantage during this 1-year period of unwind, but I, again, be remiss if I didn't bring that forward, because we're trying to bring other pieces into that system. Just because we think it's, again, better for our workers and better for the folks as they come in so they can access like a virtual one-stop shop. We are not there. But it's where we're trying to head.
I'm glad that you brought that up because I circled that and made a note when I was reading. And I mean, for folks who don't know what that is, it's looking at eligibility for all benefits. So it's SNAP, TANF,
Medicaid and
And
SHOP.
Child
Medicaid.
care.
Sorry, yeah. Oh, and CCAP. Yes, yeah. So yeah, it's a good way to coordinate, and especially if you're dealing with the same person and all these benefits, who wants 4 phone calls? So yeah, okay, thank you.
Co-Chair Meredith.
Thank you, Co-Chair Mead, and thank you, Secretary Freelander, and you folks for testifying. I think when we brought this subject to the table last month, I personally didn't anticipate the firestorm that resulted from it. Apparently, it's a problem that's been growing for some time. I appreciate the effort you're all putting into it, but I'm not convinced that we're on a sustainable path to recovery. And I guess the first question I had for you, again, it is a tsunami. What I learned last month was it kind of started with Jefferson County, and now I understand Fayette County has not been current in their processing, has not been for some time. When I specifically asked the question, the response was, well, forever. When we got more specific, it's 2019. But what I've heard today, there still doesn't seem to be like an immediate solution for Jefferson and Fayette County. So we've got that to deal with. Then the ending of the COVID crisis has contributed to it, and apparently there's some infrastructure issues as well with our computer systems and turnover in personnel, and it grows and grows and grows. And I don't know where the turning point is where we get this back to where it should be, but is statewide processing going to be forever? Is that the new standard for processing this?
The real answer is I don't know. If we're able to get caught up in our outlying counties, if we're able to depend upon that when some of the counties that are able to be caught up would pick up some of the cases from Jefferson and Fayette, that's what we thought was going to happen, but it ended up being more challenging than we expected. Again, just put that right out there. I think once all the workers that we've hired come online in Jefferson County, will be a lot closer. I hope we get to the point where we're caught up in Jefferson County, and we're working on it. But that challenge, right? We've had to do the locale premium to hire folks, and we've actually offered folks what is called a shift different, but that's not in family support, is it?
Mm-hmm.
Is it? Okay.
For overtime.
Okay, so shift differential if they do overtime, and if you do overtime now, you can work on local cases.
Yes.
So we've offered a lot of different things. I'm hoping we are turning a corner now, but I think you're going to need to keep up with us. I mean this. I think you're going to need to keep watching as we go through the next couple of months. I think, again, I hope we've turned a corner, but I need to see more time, and you do too.
Well, we have seen a voluminous number of emails, which I greatly appreciate. It's been education in their own. But I'd say if there's a central theme to the emails I've received, it's the morale issue this has caused. You made specific of that local pay differential that Jefferson County receives. And I'd have to agree with those folks in outlying counties who are processing Jefferson County applications. So if they're not getting that, that doesn't seem to be fair. Of course, life's not fair, but how do you address that with those folks that, yeah, you got to do this, but you're not going to get the same pay as they do in Jefferson County?
Yeah, I think it's a challenge.
Yeah. I think the other piece, we agree. We recognize the challenge of that too, but the in-person work that happens in Jefferson County looks very different than what it does across any of our other counties. They have a large population that is non-English speaking. So to work in their lobby and to work and to provide those essential day-to-day in-person services really looks different in Jefferson, and that's been a big piece of that locality premium. And I will also just, we have counties that neighbor Jefferson, and since offering the locality premium, that has not been an incentive for anyone to transfer into Jefferson to do the work. 'Cause it is more of a challenge to work that front lobby in Jefferson than what it is across any other of our regions. And staff that have gone and have helped and assisted have shared that as well.
Last year, again, previous administration completely redid the waiting rooms. They are, compared to what they were, people who come in to the L&N building in Louisville at 9th and Broadway, who haven't been in since the redo, are just stunned at how much nicer it is. A year ago, I was really excited because there weren't very many people using our waiting room, and I thought that was great. Those days are over. We now have, there are basically 2 floors that travel half the block of Broadway on 9th Street, and anyway, it's a long block. And we're starting to use both waiting rooms. So it is the thing that worries me about where we said if somebody walks into your office, you get to process. I get worried that even our smaller county offices are going to get overwhelmed. We're going to keep an eye on it, right? On all of it.
When we get back to whatever our norm is, will the norm be that Jefferson County and possibly Fayette County will still be behind?
I hope not. I mean, I can't. I won't promise you something that I can't promise.
Another thing I hear or read from my emails is when we talk about the infrastructure itself. Specifically, what comes to mind is conduit, which is supposed to be helping our people, but I think the assessment of most people that are in the field that it's not. So how do we monitor that? How do we hold those folks accountable? Do we look at other alternatives?
I'll start. Conduit has actually been I understand the perception of the field.
Perception's reality, though.
Yeah, I know. I grant you. But Conduit has really been helpful in terms of how quickly they've been able to staff up as opposed to how quickly we've been able to staff up. They're faster than us. So they have been, my perception, and you talk to the field a lot more than I do, they have been helpful. So I did have an argument with Conduit when they were trying to do case decisions, but what they do, they answer the phone and they do a pretty good. Their wait times are seconds, but that's the first tier, and then once you get to that second tier is where you have the big wait time.
Yeah, and I think I may have been answering Representative Moser's question about tech with Conduit. I think that's where we hear some of the frustration from our staff because Conduit is that they're doing that initial screening of the call, and then again the client they can't serve them, so they get transferred to a DCBS worker. The client's very frustrated because they've already told all this information to Conduit. So there's some of that because again they have to tell their story again, and then we're continually asking for feedback from our frontline staff. What is working? What's not working with Conduit and with tech, for that matter, so that we can go back and we can provide additional training or support to our Conduit staff.
I was just going to say there are monthly meetings with Conduit where they report out on all the metrics they track, and one of the numbers is call transfers to DCBS, which is I think is at level 2 anyway, and and then they track, what the reason for the transfer was. And the point is to keep track of, are they doing all they can to answer the question? Are they doing all they can to keep from having to transfer to DCBS if there's no need for that? If it's just to check the status of the case, to see if, my document that I returned has been received, that kind of thing. So they're absolutely tracking to that, and that serves a couple of purposes. Number one, make sure we know they're tracking that and they're, trying to improve the service to clients. Number two, to help them train staff to figure out if, they monitor the calls, they'll listen to calls as part of the training process and go back and figure out what could this person have done to prevent this call that didn't really need to go to DCBS. So just wanted to address that. There are processes in place. Not to say that, the field, any call they get, right, is one that Conduent couldn't help with. And Secretary Friedlander's point about the limits of non-merit staff in terms of the SNAP program is one of those, one of the reasons for that. So here, the frontline staff, I used to be one of them, but we do try to show improvement and track what Conduent's doing.
Well, I appreciate that, but again, when we engage these people, it's supposed to be because they're the best in their field, they're the experts, and a little bit troubling saying that we have to tell them how to do a better job. I'm just curious, how do we truly measure the success of this company, and who's responsible for measuring their success?
Monthly reports. I get dailies because I look at our call times, so I can watch when it goes down and goes up. And it's I'm happy to supply you one of those if you'd like to see. And but that's we're tracking daily what it looks like. There are some days when my heart sinks, but that's what we do. And when we need to, we call the company in and ask for assistance. Oftentimes, actually, they've provided us with some recommendations about better ways for us to handle our call volume. Sometimes that's worked. Sometimes that hasn't. Sometimes we like their advice. Sometimes we don't. There is a back and forth and a dialogue primarily around the phones with the company.
Mr. Chair, if I could, just one other question. That's regarding Kentucky Connect. Had some frustration with that system as well. What's your assessment of where they are and their capabilities? And one particular email I thought was interesting that when Deloitte was hired to put this together, it's supposed to be a very short-term proposition, and 10 years later, they're still on the payroll. That's kind of like funding your own retirement, but is this a good product? Or do we need to look at another vendor?
We are continually looking at our system, and I know we are currently looking at looking at where there may be opportunities for improvement. I think that relationship, there's good and bad with any of that, but I think with our current system, it's parts of that are nearing 10 years old, like you said. So it's time to take a look and see if we need to modernize or make some enhancements within that system. We talked about earlier that we're kind of we're pushing on it, but yeah, I think we're at a point to where we can and should be looking at some of those pieces.
The most challenging piece that I think we have, and I think you saw it addressed in many of your emails, is what's called the worker self-portal or the self-service portal. That's been a challenge from the start. It was designed to allow folks to update their documents and be able to provide them virtually, so they didn't have to come in the office or anything like that. That we continue to work on that. The biggest challenge there is actually not a Deloitte product. It's called COG, and it's how people do identity proofing and log into our systems. That's 15 years old, I think. I might be off by a year or two. But that piece has been the piece that's frustrated folks in the field, the individuals who are trying to get into the self-service portal. That's been a challenge because it's old technology. We've got to work on that. We have what's that called? I'm gonna get the wrong name, but anyway, we have a call to update and modernize it. I think we put out, there we go, RFP. I think we put out an RFP to modernize COG. That's been a real choke point in the system.
So when is this disaster rectify itself?
Well, it depends on which part of it you're talking about. If it is, when are we gonna have the third of our workforce trained? That's gonna come online.
No, I
Those
think the
folks are
litmus
gonna come
test is the
on.
processing of the applications. That's the litmus test. Is
Yeah.
when will we be current?
I hope we will be current probably this winter. But that's our goal.
When?
Winter.
Winter. Of what year?
This current winter. Now, whether that spills over to January, February, right? I'm thinking that's probably more realistic. If I'm giving you a realistic, I'm hoping February. We'll see. You'll get to call me. Well, you may or may not get to call me back, but that's what we're hoping.
Well, I hope and pray as well. But again, my concern is the norm's going to be that we'll probably be current, maybe most of the other counties, but Jefferson County, possibly Fayette County, we're not. And I don't know how much longer we can let that situation continue to manifest itself. It's been too long. And sorry for my impatience, but the world I came from, there's expectations and accountabilities, and if you don't meet them, then we go to Plan B. I'm not sure what Plan B is, but thank you, Mr. Chair, for your indulgence and allowing me to have these lengthy questions. Thank you.
Absolutely. And we're going to continue on. We've got a couple of folks who signed up on the guest list that said they possibly wanted to speak. So if that's the case, I will ask them now. The first name on the list is Tatiana Rose. You'd signed up for possibly. Would you like to speak? Okay. Come on up. Can you come up and speak at the microphone? Miss Rose, as you sit down, just state your name and then tell us whatever you'd like for us to hear.
Yes. Sit here?
Yes.
So my name is Tatiana Rose. I'm here as a concerned member of the public.
All right. One more thing. As you, if you look down at that microphone in front of you, there's a button that says push. If you have that green light come on, and
Yes.
now we can hear you. Go ahead.
Okay, do I need to repeat?
You're
Yes.
good. Yes, please.
My name is Tatiana Rose. I'm here as a member of the public. My son is on home and community-based behavior. And I have had troubles with this process from the very beginning. We applied back in October of last year. He was approved for home and community-based services, but now it's October and we haven't received any real help. I've been in contact with Protection Advocacy. They've been trying to help us. And regarding the task force, so for example, the problem now is, and my son is actually, he has been approved, he's eligible to receive services, but we are not getting any services because apparently there is some kind of problem with MMIS system that is processing claims. And for 3 months now, I've been receiving updates that Cabinet is working on the problem, but it's not resolved yet. So every other week after week, I receive emails, it's not resolved. Basically, we have almost 3 months worth of claims that has not been processed for this technical issue. And I've been having other problems with the system. When you call, for example, the help your desk, like home and community-based behavior help desk, a lot of times the question or the issue, I would not even get a response back, or just like a formal response again, that they are working on this issue and looking into it. So I do have a lot of concerns because at the end where we at, my son is 4 years old. He has been diagnosed with cancer, with nonverbal autism, and scoliosis. He is in upper body cast. So we really need help. And once we were finally approved, I was hoping we'll be getting help. But it's almost a year into it with pretty much no help. And I'm not sure where to turn. And that's why I'm here today and, asking, for help to address those issues. And I know it's not just me, because I know it's a lot of people experiencing similar issues. So I appreciate you listening. I appreciate you letting me to speak here today. Thank you.
Well, thank you for coming and giving us that information. Mr. Secretary or Commissioner, would you all like to respond in any way? Maybe we can give Ms. Rose some information and possibly some assistance.
We will. I think you've been talking to Pam Smith. Is that right?
One of the people, yes.
Yeah. Okay. So we've been trying to work some of these issues out. This is partly related to participant-directed services, and it is a billing issue. There is a mid-biller, and we hope you'll see something very soon. But we've been trying to work on it, and she's right for a while now.
Is there any way to get her in touch with somebody that we can make sure assists her through the process?
I will make sure of that.
Thank you. Appreciate that. The next person we have on the list is Amanda Nichols. Would you like to come up and speak? Just state your name for the record and give us any information you'd like for us to have.
I'm Amanda Nichols, and I am actually an employee of the cabinet, and employer morale is quite low. And for the tenured workers, one of the biggest issues with that is because they had this 90% midpoint. Some people had to wait. We were supposed to get it in like December or January, and then it got like certain positions had got it at different points. Like some people waited 4 months. Some people, like me, I had to wait 10 months. Some people still haven't got it at all. And also with the conduit we were speaking about, we have many clients, almost daily, if not more, that tell us that we do this application and then they're like, we just answered all these questions, like, well, we're doing it twice. So I'm not sure what's going on with that specifically, but I just wanted to address that. Yes, that is something that is going on. Thank you.
Well, thank you for coming and sharing with us that information. And that seems to be a recurring theme in some of the messages that we've received. So we'll continue to work on it. Are there any further questions or comments from the committee? Representative Neighbors.
Since the switch from the local processing to the statewide processing, how many complaints have been received by the Ombudsman's office in this regard?
I don't know, but I can certainly get you that information. We do track in the Ombudsman's office complaints, so we should be able to get you that information.
I've got a few comments as we close out. And I want to preface this by saying that, Commissioner, I've seen you in many, many different roles in that cabinet, and you've done a great job in all of them, and I feel secure that you're going to do a good job in this one. And I know that you have inherited a mess from your previous predecessor, and so I appreciate all that you're doing. And Secretary Friedlander, you've been very open with us in communications when you can be, and I appreciate that. So my comments are, I ask that you don't take my comments personal, that they are not directed at you in any way. I think I'm going a little bit above your head when I speak to some of these issues, but I want to read you a few of the messages that we've been getting from some of the workers, and some of it is is kind of concerning. It's concerning to me as a rural legislator, and I'll explain more about that in a few minutes. But the first one I want to read to you is that the attached documents were obtained through open records requests made to the Personnel Cabinet in 2022. These documents show that Jefferson County family support workers, supervisors, and clerical were granted a $4 an hour additional locality premium, which I understand that is for retention. But I will tell you that the issues that we are having, and especially in the rural parts of our states, we're going to create an even bigger problem with retention across this state if we don't figure out a way to rein this in pretty quickly. But anyway, it says, the last thing it says, I wish to call your attention to the last sentence on the first page in the section titled Remarks. Over the last year or more, that struggle has grown into a full-fledged crisis that can no longer be pieced together by creative plans or staff assisting from other areas. So we were warned that this was not going to work prior to even implementing this statewide processing feature. And she closes out by saying, all we're asking is for someone to step in and make some sense of the madness so we can do our jobs effectively, assisting those in need. The next one says that evidently they either predicted the presentation today or they saw the presentation today, because they said in this, they're using the Medicaid PHE unwinding as a contributing factor to the backlog of cases. Unwinding began on April 1st of 2023. The backlog in our cases did not become an issue until after statewide processing was implemented in June of 2023. They're also using employee turnover rate and training of new employees as a reason for the backlog. The turnover rate is a result of their own actions. Employees left the agency due to incompetent management. Additional training has all been pushed out until next year, and trainings for the KTAP and adult medical programs such as state supplementation have no training scheduled at this time. The next one said, before the statewide processing mandate, only 5 or 6 counties were severely past due, but now all 120 counties face this issue. The next one is from someone who works in a rural county. It says, my home county is a rural county and we are a smaller county. Before the change, our county was never past due on task, and as of this morning, we have tasks that are due back from June. The next one says that we have to look, another one from a rural area says, we have to look at our local clients in the face daily and tell them that we can no longer process their cases. It is not fun to tell someone who is desperate that they are not allowed to be helped. This one says, I am reaching out today with the hope that someone will take notice of a great injustice being done on the residents of this Commonwealth. Due to the statewide backlog of processing cases, Kentuckians are going without these much-needed benefits. Families are going hungry and are having to postpone health care benefits. The next one, and this is the last one I'll read out of this group of messages that we received, but this one was also disturbing to me as well. As you can see, there's more than a dire need to act quickly to find comprehensive resolutions to address the mounting problems with DCBS across the Commonwealth. When I personally look at these numbers, I see people. These are families, elderly and children who are suffering at the hands of the cabinet. Statewide processing was implemented approximately June of 2023. Until this time, our county was not behind on processing tasks. Most of your rural counties were in good places with processing and taking applications timely. We're more than happy to assist in the backlog. However, the citizens of our own local county are now being placed in the back seat. I said that was the last one. I lied. Here's the last one right here. But it talks about that they watched the committee on 9/26, where a local office supervisor and principal were questioning family support business processes of the state about past due work. I want to express my frustration watching them answer questions that should have been directed at our leadership. Of course, that frustration was shared by us as well, and we addressed that, and Commissioner or Secretary, you addressed that. Appreciate it as well. But it says that our citizens in rural areas are suffering. A recent change was made to the system that we use now that limits field staff to access to see tasks due by region and county. This was done secretly and without prior notice of the field, which led to massive confusion across the state. I've been in rural areas where I was able to help just myself and my staff clean up in our local county and then move on to these larger counties. What kind of accountability is fixed in this process? Again, the answer is none. And then the last thing she says is, I feel these two individuals that were testifying were made to look ridiculous and giving evasive responses because leadership knew that they wouldn't know the answers to all the questions that this panel will have. I love the idea that you want the data and you plan to obtain it. Leadership doesn't want to take the heat or blame for what they've caused, but they are the ones that have created this train wreck and have sadly handed it off to frontline staff who have pleasure of dealing with irate clients daily. And then the last thing I got in an email was a status sheet prior to statewide implementation that says, support services task past due list, and it shows that only 3 areas at the time had past due on it. That was prior to statewide. After statewide, now all of them have past dues. What I want to say out of all that is that our rural counties are suffering because they have been forced to process those Jefferson and Fayette County cases. And the first thing that we should be doing is allowing those counties to process their own citizens first. I represent a rural county, so I understand that I'm selfishly going to feel that way, but that's the way it should be. We should process those counties first, and then once they're caught up, we allow them to move on to help Jefferson County or Fayette County, whatever it may be. But we know Jefferson County's been behind for a long time, and if they can't be caught up, maybe the answer is to privatize them. Maybe we need to move away from the system that we're in now. But I'm also going to say this, and you all, as I said, Secretary, have been very good with communicating with us when you can. But a lot of these problems and the problems that we've seen in the past that have come up, and we've talked about this before, and I don't know that we could have helped with this situation. This is one that may have gotten out of hand, but I also do know that the recertification Medicaid was coming for quite some time. We knew it was coming. We just, I don't know if we didn't get prepared for it, or maybe we did, and it was much more overwhelming than we thought. But many of the problems that we've been seeing are due to a total lack of communication from that governor's office over there. We can hear a constant theme from workers in the cabinets and the departments and the commissions across this state that we have been told by the governor's office not to talk to you. We are one of the 3 branches of government, and we cannot effectively make legislation if one of those branches will not communicate with us and give us the information and the data that we need on specific issues. He's out there running these commercials that he's brought people together, that he's the one that has brought both sides together, which I will tell you, as being in House leadership, that is not the case. We might have met with that man 3 times as House leadership in 4 years. He's vetoed over 100 bills that we have passed in his time in office, and he's taking credit for things that he didn't do. He claims to care for the people of this state, yet when it comes to the mistakes that he's made and this administration has made, he won't admit them, and he won't work to correct them until we publicly bring it out. Just like the unemployment fiasco we saw back with COVID, and now this with public assistance benefits. The last thing I'm going to say that ties into all this is there is data out there right now where Kentucky, if I can find the data that I had, I may have threw it away here in all my discussions. But we have seen a drastic increase in Medicaid benefits since this governor's taken office. We have seen a drastic increase in SNAP since this governor's taken office. We have the lowest workforce participation rate that this state has ever seen. In the last year, in the last 3 months, we've seen 10,000 people leave the workforce. Yet we're talking about how great this economy is. And the biggest issue out of all of this is we've seen SNAP go up, we've seen Medicaid go up, is we're not willing as a state to help the people once they get in those situations. We won't do anything to correct it. And that's the problem right here with this process. And the last thing is that since he's taken office, we've seen the average median income of households decrease by 12.6%. That's part of the problem. We've gotten to this place. We're not willing to fix the system. We're not willing to help people when it comes to those situations. And we have got to do something to change this process before it really gets out of hand, because our rural counties and our people in our rural areas are suffering more and more now because of this situation. So I just ask that you all take a look at this process and maybe we back up just a little bit and work to make sure that those folks aren't suffering. Does anybody else have any comments? Representative Mosier.
Thank you, Mr. Chairman. And not exactly related to this discussion, but I got a text from a family court judge in our area, and I just have a quick question. I know that we've discussed the children who are under DCBS watch sleeping in case worker offices. We know that this is happening in Boone County, and I'm just wondering what's being done, what has been done to rectify that situation. Are we seeing an improvement?
So most recently, sorry, I should probably say Eric Freelander again, Secretary of Health and Family Services Cabinet. We've increased our PRTF rates pretty significantly. As we looked at other states, many of the other states had done that, and so they still haven't been able to completely not have issues like we see. I think probably 40 other states are suffering the same way we are. I was on the phone with somebody from South Carolina yesterday. So we hope that makes a difference. We are talking with our partners at the University of Kentucky. We're talking with our childcare partners tomorrow on what we can do with emergency shelter. We'll talk with some of our other partners around what we can do with some perhaps staffing support. But it's, if I'm telling you, just like the other, that we don't have kids in offices, that isn't accurate. We have a couple of three kids in L&M building.
No, one.
One in
No,
L&M,
we get
but
three total across the
three
state.
total across the state today.
Yeah,
Probably
Okay.
Boone's the second, and I'm not sure.
Western Kentucky, I believe.
Yeah, so that continues to occur, and we hope that some of these changes, we put out an RFP. I think I've told you all, we put out an RFP for high acuity youth, and got no responses. I was sure we were going to get responses. I'm disappointed that we didn't get responses, and it is, as has been noted by some of you, that the expectation is folks take kids if we contract with them, and yeah, I myself would like to see that.
Yeah, I mean, as we're talking about the more severe cases and the higher acuity, we don't seem to have housing for even transitional or temporary housing for these kids. I know that I've had conversations with Children's Home wants to expand their services, and the Home of the Innocents is also looking to expand their services. Is this something that will help with this particular situation, or I mean, I know the Home of the Innocents has a slightly different population.
Hopefully, we just heard really recently that Children's Home of Northern Kentucky is going to shift who they're caring for, and move from the more residential to PRTF, which is what we need.
Yep.
And hopefully some of the rate changes have helped with that. That will address some of the high acuity youth. The other piece is that will give a backdoor. That'll be a way that children can be transitioned from acute psychiatric hospitals into PRTF. But honestly, some of these kids, there was a very sad news article. What was that on Wave? I think it's been on, where a kid was admitted to a pretty bad act, and that's kind of the type of kid that we're dealing with, and so that's the challenge that we've had.
Right, and I am grateful for the increased rates in PRTF. That's made a huge difference to places like DCCH and some of the other residential programs in our area. So I think that is helping. I know that enabled DCCH, for example, to reopen some of their they call them apartments. They're separate buildings for probably up to 10 kids. So that has helped immensely.
Yeah, and we're working on this is a little off subject, but we're working on our certificate of need regulations, and I know you all have had a task force on that particular issue as well, but really moving that PRTF bed from a really kind of tightly controlled to a much more loosely, let's get more in. I think that'll be in front of reg review next month, so it'll be in front of your all's committees the following month. But that's, and we've been, I was thinking we could do something for the universities, but that looks like that's perhaps not going to work. So we were holding it to see if we could. But I think that'll be a good change, and I think there'll be more of the higher need beds coming soon. The other piece is, and I think this is a challenge, and again, I think some of us have talked about this, you know, the what we call no eject, no reject, meaning you will take the kid, right? Because we haven't had the response from the provider community that I wish that we had, I will tell you, I don't want to open up a facility, but if we don't have any other choice, that may be what we have to do. And I really don't think we do again, I have a long history, and this is a whole different subcommittee hearing, and I would be happy to do that. But I mean, the whole reason there's a Department of Justice, DJJ, is because in like the late 90s, early 2000s, what was called Department for Social Services, which would be DCBS, there was a consent decree from the Department of Justice because we weren't able to serve the kids in DCBS. That was before Medicaid expansion. That was before K-CHIP. But that was the impetus of why we have DJJ. I would welcome the opportunity to like walk you all through all of that kind of sordid history, but it's real. And it's kind of, in part, why we are where we are today. Sorry, that was a much longer answer than I think you wanted.
No,
but
this is good.
yeah.
It's good. Yeah, it's stimulating a lot of ideas. All right, thank you.
Senator Meredith.
Thank you, Co-Chair Meade. Just thinking again about the backlog specific to Jefferson County and what we've done to statewide processing. Now, in essence, everybody feels they're behind. I was intrigued by Co-Chair Meade's suggestion that maybe Jefferson County needs to be privatized. I don't know, maybe that's worth looking at, but obviously there's got to be some supplemental help here somewhere. So is there being consideration to maybe a hybrid model where you have Jefferson County, but yet we privatize that portion that has lapsed, so to speak, so that they can focus on that segment? Maybe an interesting experiment just to see how privatization works in this particular area, but would that make sense?
Happy to think about it. We have not in this area. We did a little bit with some of our backload in Child Protective Services in terms of closing cases that were past due.
We still are.
And we still are. So we've done but it's not in this particular area. There's some. It's a longer discussion, but there are some. I was trying to reference it when we were talking about the SNAP, meaning that you had to have a state merit worker to actually make the eligibility decision. So there's some challenges there. But we're absolutely willing to look at whatever we need to look at to make sure folks get services. Absolutely.
Well, again, we can't maintain the status quo, and this has been a problem since 2019, maybe even longer. We need to look at a different option. And I just think this may be one that we kind of step our toe in it a little bit, but don't fully commit to it. But we get some idea that maybe it can be impacted positively. Because obviously the issue is lack of resources for Jefferson County, and the things we've tried in the past haven't worked. So if we can incentivize the private sector to get involved in this, and we have in other areas of healthcare, why not consider a hybrid model? I just ask you to give some thought to that.
Thank you.
Thank you, Mr. Chair.
Senator Funky Fromeyer.
Thank you. All of this is tying right back into this wellness or this lack of wellness. And you said that you might be willing to get into some of the sordid details, and maybe today isn't the day, but I don't even know. I'm a financial advisor. I don't even know what PRTF is.
Oh,
but I also know that I spent about an hour on the sideline of a soccer game on Saturday next to our newly elected family court judge. And she told me that she lost someone in the last month that she did not remove from a family's home. And she didn't remove them from the family's home, even though she knew it was tremendously dangerous, because she didn't want them sleeping on the floor of the nearby center. I also have Holly Hill in my backyard, who has 3 of their 4 facilities with no one housed. And I don't know what that means when you tie back to the certificate of need being so tightly controlled versus more loosely controlled. So I really truly do want to understand this. I also know that in Campbell County, Pendleton County, and Bracken County, I have some of the largest number of church attending folks. And I don't know where along the way our church communities stopped being housed or homes for more of our children that really need this care. So I heard it in a conversation with another representative here in the legislature that no, we don't want churches so involved in these problems. I'm not sure why that needed to be stated. And I'm not sure if we're actually missing the opportunity to have thousands of people in our community help, but are they somehow restricted? Is there something that we've placed, a barrier that we've placed with this PRTF process or other processes of trying to house these children in some of the most dangerous points of their life?
Not that I know of. I mean, we are always looking for additional folks who would be willing to be foster parents. Period. That's who we want. As a matter of fact, most of the children who have been in offices have been placed in what is called therapeutic foster care. So that's somebody that has an area of expertise and can have some services that are brought to them that can keep that child in a home, in a community. Now, some of these kids are beyond, I think, what that particular level of care. But even some of these kids that everybody else is rejecting, we've been able to place in therapeutic foster care. So it's finding the right payment mix, the right service mix. I think there's what's the subcommittee, the MST, where do we? Oh, Psychiatric Residential Treatment Facility first. I'm sorry, I did use initials. Those are small facilities, 16-bed facilities essentially, that can serve children who have significant behavioral health issues. Sorry, I used the initials. I apologize. And the certificate of need was that there were a certain number of those beds per area development district, and we're taking that limitation off. So I can do that pretty quickly.
Thank you.
Mm-hmm.
All right, the next meeting of this task force will be on Monday, November the 6th at 3 p.m. right here in this room. And with that, is there a motion to adjourn?